Okay, guys. The last thing we're doing this year is taping. So the onus is going to be on you guys to practice and you know to get good at something like this. It's a manual skill. So repeated practice. So what you will see for the days we're doing this, like next week, we'll have just this notes and then basically practice days for the rest of the week. Um, So I would encourage you to make sure that you are doing those practices. And for each practice, we're just going to document it with a photograph so you can kind of show me that you are getting your repetitions in to become good at something. But before we do that, we need to look at some taping fundamentals about what tape is used for and a couple other things. Okay, so we looked at tape a couple of times this year when we did fingers. We talked about how it's there to kind of support soft tissue, ligaments. But tape can actually be used to do a few different things. Things that are different are listed first, like tape can be used to temporarily or permanently close laceration. So it can be used in cuts. Now, you never want to put a tape directly over a cut because when you rip that tape off, it's sticky. It's going to pull the cut up and any scab that's formed. But what I've quite often done is after you put a band-aid on in an athletic event and they get sweaty, those band-aids don't last very long. So taping over band-aids can help keep them on and help close up that laceration. You can also use gauze pads and tape those down as well. Tape can be used to prevent blisters. So if you're doing a repetitive action, typically it's running, and you're starting to get blisters around a contact point, normally heel or an edge of a toe. You can line it with tape so that the tape absorbs the friction and you don't get the blister. They can be used to hold bandages, pads, dressings in place. So they're used for that. In a similar manner, you can use them for minor splinting. You have to be a little careful using tape with splinting because obviously it sticks to it, and then to get it off, you can end up kind of pulling at that splinted area, which can be damaging. If you are ever using tape in a splint job, you want to make sure that you cut it off. You don't try and unstick it because that's going to cause the damaged area to get moved around, which isn't ideal. Now, the last two are where we've traditionally looked at taping so far this year. So the first one is restricting motion to support and eliminate stress on the ligament. So if you have like a sprained ankle or a hyperextended finger, that's a sprain damage to the ligaments around those finger joints. You can use it to support it so that it has prevents it being hyperextended again, or can limit the amount of damage if it's aggravated. Okay, in a similar way, you can use it to compress and support muscle and tendons as well. Okay. So those are our major uses of tape. Before you begin taping, things that kind of you need to think about. Firstly, is the anatomy of the injury. Okay, because if you remember when we first looked at fingers, we talked about taping along the lines of the ligament because you want to provide support to that ligament. Okay, so you want to kind of follow the lines of the soft tissue. Okay, so you need to have basic understanding of the anatomy to be able to do that. You have to listen to the athlete, firstly, to get information about what the damage is. So you're using the tape in the right way, but also to give you feedback as you tape up. For those of you who have been taped before, if somebody tapes you really, really tight, it's uncomfortable, cuts off blood supply. So you have to be able to listen to the athlete. You want to make sure that the athlete's in a comfortable position when you tape them because they're going to be holding that extremity still. And for some of you, it's going to take a while to tape an ankle for the first time. So you want them to be comfortable so they're not stressed while you are taping. You want to make sure that you instruct the person being taped to limit motion. Okay, so we're looking to provide support to a joint. We need to keep that joint still during the taping procedure so that we're fully supporting it. If you half tape something and then move, you're extending the tape. and it's not going to be fully supported. This is really, really true of the ankle. So you want to put the ankle in a natural position, not dorsal flexed, and tape it in that position. Lastly, you want to put the athlete in a position where you are comfortable, especially if you're doing a bigger tape job like a knee. Um, if you have them on the ground and you are bent over for 10 minutes trying to do it, it's really uncomfortable. That's why if you've been to one of our sporting events, you will see sports med 2 students carry a treatment table. So you're putting the athlete at waist height, and it's much easier for you to treat tape and any other treatment that you're doing. Okay, what does taping not do? Um, it's important to understand both as a trainer, but also for any of you who are athletes, taping does not prevent injuries. Okay, it is not there to prevent injuries. Okay, it can lessen the extent of an injury, but there is no tape job that's going to stop you getting injured. Okay, sports have an inherent risk. So, if you roll your ankle really badly, even if it's taped, it's still going to damage it. So, what you kind of have to think about is, firstly, what the tape is there to do. The big deal is that it decreases the severity of the injury, and can kind of allow you to continue to compete, because you've lowered the extent of that injury. Um, if you are getting like lots of injuries, you might want to consider alternate modalities of treating, right? So the example that's here up there for you is, instead of taping every single person on the team before every practice and game, you might want to consider doing some more like proactive training of those ankle areas, so that your athletes are becoming stronger there, and the musculature is more adept at preventing injuries. Okay, the other thing that you can use is, there are preventative ankle braces. There are preventative braces that you can use. Now, I think that's not the best description of them, because like they can't prevent every accident. Okay, I also have issues with using preventative aids, because often what I see is that you get hypertrophy. It's not hypertrophy, atrophy of the muscles around them, which basically means that the joint becomes more reliant on the aid rather than the musculature. And what I have seen subjectively in my experience is that teams that make every athlete wear an ankle support, that's the easiest example for me to think about, is ultimately you get more injuries, because those athletes aren't being trained to withstand those forces with their own musculature. Okay, that's a little bit off topic. Okay, taping guidelines. Now, for those of you who came to pick up supplies or got your own supplies, you'll notice that we gave you the pre-wrap. Pre-wrap is there for comfort. You actually get the best experience to tape directly onto the skin. Okay, if you're taping onto pre-wrap, there is a little bit of movement as the tape slides over the pre-wrap, because the pre-wrap's not sticky. So the best thing is to tape directly onto the skin. Now, for most of us, we all have hair on our skin, except for the palms of our hands. So if you're taping directly over that hair, it's going to get ripped out. It can be a little painful. So it's best to shave it and then tape over the top. Now, a lot of people choose not to do that and choose pre-wrap anyway. So if you tape directly onto the skin, there are some problems that can arise. Like firstly, just it irritates the skin. If you're constantly like pulling it off, putting it on, because they are quite adhesive, it can irritate the skin. And to constantly shave your ankle is not much fun, because it's not the easiest place to shave. And some people do have allergic reactions to the tape. Oh, when I was writing this out for you, it made me think. I had a friend of mine on a volleyball team I grew up on playing on. He had to have his knee taped, and he was like a super hairy guy. And so he shaved from mid thigh down to mid calf on his probably it was a right leg, I think, and so he shaved all that off so he could be taped. But then he looked super weird playing beach volleyball in the summer because he had like a hairy top of his thigh, and then it was like baby soft skin all the way down to the middle of his calf muscle, and then hairy again under that. So pre-wrap is a pretty good alternative. All right, so purpose of taping, we talked about the five things that taping does. Basically, what you're doing is you're supporting the bony anatomy and controlling the stresses placed on the soft tissue, which is ligaments, tendons. Um, and the typical injuries that taping is there to deal with is tendonitis to provide some support, same with fasciitis. And then with sprains and strains, it's there to support, limit motion, and protect that soft tissue as well. Okay, so those are the conditions. I think this is the last thing. Yeah, so the things that you want to avoid when you are taping. Firstly, let me go grab the tape out. So I'm here. Firstly, is avoid trying to tear tape that's been folded in any way. Okay, so when we first got the tape out last year, I showed you how to tear it with fingers together, pulling and tearing. Failure on the first attempt. How sad. Okay, and then it just tears away. As soon as you get a folded edge, like if that edge just gets folded down a little bit, that will not tear very easily at all. Okay, and I can't tear that. Okay, so you want to avoid trying to tear on anything that's been folded. Now, when you do the ankle tape, it's going to be a little harder than the taping jobs we've done, because basically what we did for the fingers was take a piece, tear it, prepare the strips, and apply it. But when you tape the ankle, you're going to leave it on the roll, and you're going to wrap it around in place and then tear. Okay, so you really have to be competent at tearing. If you fail, like I did, the first thing you probably noticed, when I failed, I didn't try and tear it again there. I pulled it an extra ½ inch and then tore it. Because if you try and re-tear it on that part that you failed, it will not tear very well at all. Okay, so that's some tearing stuff. Next thing is you want to be aware of when you're applying the tape around a corner not to get wrinkles. Okay, so as you're going around a corner, like if I'm coming across my wrist, if I don't get it flat, you can see how this bit sticks out and it creates wrinkles here. Okay, so as you go around corners, what you want to do is apply constant pressure and tension to the tape so that it's pulled in and sticks better. Okay, so you just got to be really careful, and it's a little bit of just kind of trial and error. When you go around the corner of the ankle under the heel, is to apply constant tension around and pull it really smoothly around so that you don't get those wrinkles. Okay, those wrinkles can lead to discomfort and blisters in the athlete. The next thing is when you are learning, which will be this week, you get really, really focused on performing the pattern correctly. Okay, so when you get so focused on the pattern, okay, so I start here, round up, take it there, then you don't really pay attention to tension. You have to find that sweet spot where it's not loose, but it's not like ripped really, really tight around the joint. Okay, now that's something that I would have really liked to have been able to be in the classroom so that you could see and I could give you constant feedback about. But you're going to kind of have to listen to the person that you tape and try and get it kind of the right tension. Now, some of you might be thinking, oh, I don't want to ask anybody, I'll just tape it on myself. It's really hard to tape yourself. As just a practice, because I haven't taped ankles in a while, I taped up my own ankle and it was quite difficult. It was a real test of my flexibility, which is not great, but also trying to maintain an even tension is really difficult to do on yourself. Okay, and when we come to taping up hands, wrists, and thumbs, that's impossible to do on yourself. Okay, so you will need to find somebody to do that. The last thing is after you have a complete tape job, don't just rip it off. It's best to get some scissors and cut it off. Now you have to be really careful here because we don't have I don't have a whole class set of athletic scissors to give to you guys. So basically, the athletic scissors on one of them, they have like a really wide, blunt edge of the scissors that you can slide next to the skin, and then it cuts down so that you don't cut the athlete. So you're gonna have to be really careful when you cut yours off. You don't want to just kind of rip it off because obviously this person in real life would have an injured foot, wrist, hand, elbow. If you're pulling really tight at the tape to try and get it off, it's going to damage the injury. All right, that's it for tape notes. You can go ahead and have a look at our first tape job, which is ankle. We're starting on a pretty big one. You will use a significant amount of tape, so don't worry about using the tape. I gave you 6 rolls. That should be plenty. If you look at what I set you this week, firstly, I wanted you to go really slowly the first day and stop and take photos of each section. And then the following days, the Wednesday and Thursdays, are practice days where when you've practiced and produced it, then you can take a picture of it. Now, I've attached a YouTube video from the head athletic trainer at Cerritos College, who was the mentor for Mr. Park, who kind of helped set up our whole program. And she's really excellent. So follow along with the video for the first time, then follow along as you need the second time. And then hopefully we want to get you to the point where you can tape the ankle without having to have that constant feedback instruction of watching the video while you do it. Okay, so that's the goal for you over these practice days, is to move away from the video. All right, that's it. Good luck. I look forward to seeing your photos to see how well you do. All right, speak to you guys soon. Bye.